The coronavirus outbreak has now infected more than 6,000 people worldwide. The CDC continues to monitor travelers coming into the U.S. from China, focusing on 20 airports with quarantine stations, and Honolulu is one of them. Now, although the coronavirus has not been traced here in Hawaii, many people are concerned they could get sick. And joining us now with what we need to know is Dr. Robin Matsukawa, who is a primary care physician at Adventist Health Castle. Good morning and welcome, doctor.
Good morning. Thank you for inviting.
Yes, thank you for being here because this is a very big topic that's scaring a lot of people right now. So first of all, let me ask you, what exactly is the coronavirus?
Right now, what they're saying that it's a novel virus. I think it's characterized, or they gave it a label, 2019 nCoV. So it's one of the viruses that are mainly seen in animals. They can also be seen in human, but mainly in animals. And it's a novel because it's the first time they described it or even identified it. What makes it a coronavirus is when you see pictures of it, identification. It's circular with, I guess, little suns surrounding it, so corona.
And then how big of an impact could the coronavirus have? Because it seems like it came out of nowhere and it just continues to spread.
Yes. So there was a similar virus that came out called SARS. I don't know if you heard about it.
SARS, yes.
Yeah. So it started out in cats and transferred to humans. That ended up affecting over 8,000 people. And of the 8,000, a little under 800 were infected. So that comes out into be about 1 in 10 patients died, with over half of them being over the age of 65.
Now, a lot of people are buying masks, surgical masks, to protect themselves. How is it transmitted?
Currently, it is thought to be similar to SARS in that it's transmitted by respiratory droplets. So that's why the masks make sense. Just kind of keep in mind, as far as mask effectiveness, keep in mind it filters out the size of 0.3 microns, whereas the virus itself is actually 0.13 microns. So it's actually smaller. So it'll slow it down, but not necessarily, 100% prevention.
And the symptoms are similar to a cold. So can we prevent it like we're trying to prevent a cold?
Yeah, exactly. That's what the CDC, as well as various websites, are saying, is that basic things to prevent colds, as well as the coronavirus and even the flu, is hand washing, specifically 20 seconds. Make sure there's bubbles everywhere, and they sing happy birthday, or even twinkle twinkle little star. And when you do happy birthday, it's twice.
Not just
once.
Very fast.
Yeah,
either.
Not happy birthday to you, happy birthday to you. Yeah.
And now, if you do get the coronavirus, what's the treatment? There is no antiviral medicine right now.
Yes, currently there is no antiviral, but CDC, from my understanding, is coming up or developing a vaccine. But that's, again, in another month or two.
Okay, and then if someone suspects they may have it, what do they do?
First off, call your doctor or go to an emergency room and have them be evaluated.
What's your final message to our viewers and people out there who are concerned about getting it and it coming to Hawaii?
The basic thing I would say to the viewers is that make sure to take all precautions, such as washing your hands, avoiding touching your face, your lips, your nose, your mouth. And if you do catch a cold, stay home. There's no need to spread it. And also, as far as other prevention, is make sure you get your flu shot, because there's already been over 8,000 deaths from the flu this season. And about over 5,000 have been documented since New Year's Day.
All right. Thank you so much, doctor, for being here.